Hey guys, in the last 7 days or so, I received close to 400 emails asking about how to clean and disinfect the inside of our car to help minimize the spread of COVID-19. Now, my goal here is to basically compile all the information on the EPA, CDC, and World Health Organization websites and make a digestible video that can help us clean the inside of our car. But as you know, there are several different surfaces in there, so we can't necessarily just throw a big bucket of bleach in there and kill everything, because we're going to end up destroying the interior at the same time. So this video is going to be a little bit of a tutorial about how to do that with the recommendations of the health leaders, and at the same time understanding how we can do that without damaging our interior in the process. I want to be crystal clear, I'm not an infectious disease chemist, nor am I a doctor, but if you're new to my channel, I've been in the detailing industry for close to 20 years, and 11 of those years have been on the chemical side of the industry. Now, a few things we're going to discuss throughout this video. The first thing is understanding what the virus is and how it's transmitted. Number 2 is the 6 hot spots in the car that we need to focus on when we're cleaning. Number 3 is the definition of cleaning versus sanitizing versus disinfecting. That is a massive concept that we need to understand. Number 4 is understanding what is porous versus non-porous material within the interior. And then, of course, dwell time. That is massively important. How long a product sits on a surface to do what it's supposed to do according to the label's claim. And then lastly, we're going to talk about what are the steps that we can do in our daily life, or best practices, so that we don't bring more germs into the car that we just cleaned.
The coronavirus is part of a larger family of viruses that cause illnesses ranging from the common cold to severe diseases such as Middle East respiratory syndrome and severe acute respiratory syndrome. The coronavirus disease is a new strain of virus that was discovered in 2019 and has not been previously identified in humans. This virus is zoonotic, meaning they are transmitted between people and animals. Detailed investigations found that SARS-CoV was transmitted from civet cats to humans, while Middle East respiratory syndrome through camels to humans. As you know, this has now been classified as a pandemic, which happens when a new virus is spread from person to person with no pre-existing immunity against the virus, allowing it to spread worldwide quickly. At the time of this video, there is no vaccine to protect against COVID-19, nor any medications to prevent it. As I'm sure you've heard before, and I'll say it again, the best way to minimize your risk is to wash your hands with soap and water for at least 20 seconds, especially after being in public. Use hand sanitizer with at least 60% alcohol if you don't have access to soap and water. Avoid touching your eyes, nose, and mouth, and avoid close contact with people by adhering to the social distancing practices. According to the CDC, the virus is spread between close contact with people and through respiratory droplets produced when an infected person coughs or sneezes. The interior of your car is a hot spot for these droplets because it's a confined area that must be touched to safely operate the vehicle, and the car itself can travel long distances, potentially spreading the already fast-moving pandemic. Current evidence suggests that novel coronavirus may remain viable for hours to days on surfaces made of a variety of materials. Cleaning of visible dirty surfaces, followed by disinfection, is the best practice for prevention of COVID-19. A recent study conducted by CarRentals.com showed the average steering wheel to contain 4 times the colony-forming units of bacteria than that of the average toilet, while the gas pump was 11,835 times dirtier than the toilet seat. The 6 areas in your car that typically contain the most bacteria are the steering wheel, cup holder, seatbelt, inside door handle, gear shift knob, and the radio buttons, obviously because these areas are frequently touched by your hands. The CDC recommends cleaning these frequently touched surfaces first, then disinfecting with 5 tablespoons of bleach per gallon. But unlike toilets or countertops, this effective technique is likely to discolor your interior by removing or damaging the dye color coat of your porous and non-porous surfaces. In other words, how do we do this without completely destroying the inside of our car? To minimize this risk, we first need to understand the difference between cleaning, sanitizing, and disinfecting. Cleaning removes germs, dirt, and impurities from surfaces or objects. Cleaning works by using soap or detergents and water to physically remove germs from surfaces. Now, this process does not necessarily kill the germs, but by removing them, it lowers their numbers and the risk of spreading infection. Sanitizing lowers the numbers of germs on surfaces or objects to a safe level as judged by public health standards or requirements. Now, disinfecting is a little bit different. It kills the germs on surfaces of objects. Disinfecting works by using chemicals to kill germs on surfaces. Now, this doesn't necessarily clean the dirty surfaces or remove the germs, but by killing the germs after cleaning the surface, it can further lower the risk of spreading infections. I'm going to post a link below that shows a list of disinfectants to use against SARS-CoV-2 as recommended by the EPA. Based on the information we have today, step 1 is to clean the interior with your favorite car-specific cleaner. To do this, I'm spraying ammo lather on plastics, leather, and vinyl, which are non-porous materials. Once applied, agitate the product to create a lather. Then, immediately scoop up the lather with a microfiber towel and repeat the process on stubborn stains. Small interior brushes can be used in tight spots such as buttons and cup holders to help lift the dirt before removal. Do not directly spray any cleaners on radio screens, buttons, gauge clusters, or any electrical components. Instead, spray the cleaner on a towel and then wipe the area. To clean porous surfaces such as headliners, seatbelts, carpets, and cloth seats, I'm using ammo shag and a scrub pad. Apply the porous cleaner to the material, scrub gently, and blot with a microfiber towel. Do not over-soak headliners and avoid heavy agitation as this material is typically thin in these areas. If you have access to a small shampoo machine, these can be helpful in dispensing and vacuuming up the remaining cleaning solution to decrease the dry time. If you don't have one, a basic wet garage vacuum will help lift the dirt and dry the area. If you'd like to see full tutorials on how to clean your carpets, steering wheel, leather, cloth, headliner, seatbelts, and so on, I'll have links in the description to full-length how-to videos or videos dedicated specifically to cleaning your car's interior safely. With the materials now clean, disinfectants can now be used.
Okay, so now let's apply those definitions in the real world. So let's say you have your favorite detailing product, you spray it on a surface that's very dirty. What you're doing is you're agitating it, you're lifting it up into a lather, and you're scooping it away with a microfiber towel. What that's doing is removing the oils, the dirt, the junk that's on there through a little bit of a abrasive or a mechanical motion. But there's no claims being made that it's killing anything at that point. Now we jump down to hand sanitizer, wildly popular for good reason. When you put it on your hands, let's just say as an example, you're not necessarily cleaning the dirt off your hands, but what you are doing is removing or lowering the amount of germs on your hand. Quite frankly, I'd rather have hands that have less germs and a little bit more dirt, if that makes sense. Now, the interesting thing is when you start moving to things that say disinfecting on there, the part that's really key for consumers to understand, one, do they have an EPA registration number, which they have here. And what that EPA registration number does, it allows the company to make claims on the package that it kills certain things. Now you have to read what it's actually killing, but for us as consumers, we have confidence when we pick up this package. It says, okay, EPA has said that this has gone through statistical analysis, has gone through many chemical tests, etc. That cost a lot of time and money, so that the EPA says, you know what, yes, that does in fact kill whatever it is that it's claiming on here. But that concept alone as a consumer, when you pick this up and it says disinfecting, you then want to turn it over and read what is disinfecting and what is the process with this particular product for disinfecting. So in this case, this one sanitizes and disinfects. So it sanitizes, and it says here in 15 seconds, meaning you have to leave it on the product, on the surface for 15 seconds to sanitize it in this same sort of fashion here, where you're lowering the amount of germs. But if you want to disinfect it, i.e. kill the germs, it says here, you have to leave it for 3 minutes to do that. It has to stay wet on the surface for 3 minutes. Understanding that concept of dwell time is vital to actually using this properly. Now, if I pick this one up, which is also a disinfectant, and this one happens to be a spray, if you turn it over, it says leave for 10 minutes. The reason I'm sort of hammering this home is you can't just pick something up, spray it on a surface, and then all of a sudden wipe it off, and then you think that you're good. Otherwise, you're really not decreasing the spread, and you're sort of spinning your wheels, so to speak. So really focus on when you pick something up, turn it over, read the label, and follow the directions explicitly. Otherwise, you won't get the best use of that product.
To do this, I'm going to test the back or the inside of the steering wheel to ensure that the dye is not removed or a stain occurs. If after 15 seconds no discoloration appears, then I'm going to leave it for another 3 minutes and test again.
Okay, now keep in mind, as you're testing the material here, if it's super hot, you're not going to want to wipe disinfectants on it. Why? Because the pH level typically of these is very high. Now let's pretend it was summertime and you left it outside and it was really warm. As you wipe this, the dwell time, one, is going to decrease, so you're going to be playing with the directions and sort of not using the product in the proper way. So you may have to manipulate it a little bit more and wipe it a little bit more, so keep that in mind. But the other thing is, with a high pH and the fact that it's warm, if you were to leave it on there for too long, it's very likely that you're going to be in a condition or in an environment that's going to have potentially more staining. So For example, as a detail, a lot of the detailers watching this will go like, yeah, I totally understand. If I was to hit this entire interior with a heavy degreaser, which we wouldn't do, but hypothetically, if we were to do that, the chances of it staining are very, very high. In fact, I have a few pictures of someone who unfortunately had a black interior, it was super hot, and they put degreaser on it and they let it sit for a while, and you can see what the stains actually do. It's pretty bad. So what I'm saying is keep in mind, you want to either pull the car inside if it's summertime. If you don't have a garage, okay, then do it in the morning or at night. Just give yourself the best chance of not actually damaging the material, because this is all new territory. I'm going to be perfectly honest with you guys. I'm trying to figure this out as we go, and the disinfectants, as far as I know, and the ones that I've used or tested, seem to be high in pH, so keep that in mind.
Repeat this process on other areas of concern, especially dark-colored materials.
Now, after completing the test on the Subaru, it actually worked pretty well, and I'm thrilled with the disinfectant techniques. Now, working with black leather, I did a few tests here. I actually hit this spot right on the seat, and I'm not super thrilled, I'm going to be honest with you at this point. I don't think it discolored, but I do feel like it lightened it up a little bit. Now, this is pure just opinion, but after letting it sit for a while, I'm not going to use disinfecting techniques on the areas that are not the hot spots, meaning not the steering wheel, not the door handle, the knob, those sort of things, the seat belt. But what I am going to do is probably sanitize them. So ultimately, I'm going to clean the area like you should. That's going to help a whole lot. And then instead of leaving it for, let's say, with this one for 3 minutes, I'm only going to leave the hot spots for about 15 seconds and just sanitize. And I think I'm going to be good going forward. But again, this is a moving target. I'm trying to figure this out and understand as we go. But I'm not going to subject the entire interior. The irony is, as I'm thinking this through on camera, the Subaru interior has coated non-porous material, and that seems to be going well. But when you get into something that's a little bit more luxurious, let's say that's more beautiful or whatever, supple, let's say leather, I think you're sort of walking a fine line between porous and non-porous. The more supple you are, the more pores it is, the more like leather it is, meaning from the cow. So it's going to have pores in it. So I do think that these, as you're wiping them, are having a stronger effect on them because they're more supple. So by default, it's kind of weird. The coated, less expensive interior is actually holding up a whole lot better than the beautiful, luxurious leather that I have here. And also, it's black too, so it's got a little bit of a ding. It gets, it's got a harder challenge to do that. So I'm figuring this out as we go along here, and as I find out more information, I'll shoot more videos. But for now, I am going to stop using this on this area for sure and the rest of the seat, but I will take a gamble and sanitize the steering wheel.
Now at this point, if you're comfortable after your initial test spot, then repeat the process on all non-porous surfaces. To disinfect porous surfaces, that's a bit tricky, so I'm still researching best practices that won't discolor or stain our fabrics. For now though, I'm going to continue to deep clean cloth and carpets like we did in step number 1 until I conduct more chemical R&D. Of course, let me know in the comments if I've missed something or if you guys have found something that is a safe disinfectant for this type of sensitive material.
Now at this point, we've cleaned and disinfected the interior to the best of our ability. What are some of the things that we can do, or the best practices as we're walking around and doing our normal everyday life to avoid bringing in more dirt, germs, bacteria into the car that we just cleaned?
First, always wash your hands with antibacterial soap for at least 20 seconds before you touch your steering wheel if possible. Keep a small bottle of hand sanitizer with you with at least 60% alcohol for quick cleanups if you can't wash your hands with soap and water. Now, in the worst case scenario, if you can't wash your hands with soap and water, you don't have any sanitizer and your hands are really dirty, then have clean gloves and just put your dirty hands inside clean gloves and then grab the steering wheel, go where you need to go, and drive the car. Once you're done, you can remove the dirty gloves, go wash your hands properly, throw the gloves away, and now you just didn't reinfect your steering wheel. Now, to remove the gloves, and assuming your hands are clean underneath, pinch the wrist area and slide the gloves down and off the hand, and then curl up the used up glove in the other hand. Then take your clean hand, your index finger, slide it underneath the wrist of the dirty glove and slide it down over both gloves without touching your skin. Obviously, afterwards, wash your hands anyways. Likewise, having a mask handy is always a good idea in case you or one of your passengers may be sick. Now, I always wear a mask for detailing because I do a lot of cars and I encounter a lot of mold and a lot of junk. So I make it a habit to wear gloves, mask, and eye protection as a daily precaution and to avoid bringing it back home to my family. The most forgotten area to clean are your car keys. Now, most require the key to be present when you get in the car, so you're going to have to push the button at some point. And think about it. When was the last time you cleaned your keys? The correct answer is probably never. So think about how many years you've had that key fob and how many times you've pushed it. It's probably pretty gross. Lastly, speaking of gross, getting gas or refueling your car is completely disgusting. If you can use a gas glove to touch the nozzle, that is fantastic. Some gas stations have little baggies, while others have, towels or little wipes or something. Use that. But either way, be prepared and avoid touching the handle at all costs. The irony here is the button that you push to select the grade of gas you want to put into your car is statistically grosser than the handle itself. So what I do is I pick up the handle and then I gently tap whatever grade of gas I want, and then I fill up my car. So I do everything in my power to avoid touching anything when I'm at the gas station. Now, I hope you found this video helpful in our effort to minimize the spread of this pandemic around the globe. Now, I highly encourage you to go to the CDC, the EPA, and the World Health Organization website and research as much information as you possibly can to be educated. This is changing on an hourly basis. So whatever you can do to sort of minimize or help us minimize the spread and sort of squash this immediately so we can all move on with our lives, I think that would be a really, really helpful thing. So as always, thanks for watching. I want you guys to be smart, be safe, and be well. So I'll talk to you guys soon. Thanks.